I'm Nora Duncan, State Director for AARP Connecticut. Welcome to another episode of Coffee and Tea with AARP CT, a biweekly interview series on the issues that are important to people age 50 plus in Connecticut and their families. Today, we are speaking again. Has not been this year, but we have spoken with Mairead Painter, the state's long-term care ombudsman in the past, and she's kind enough to be with us again today. And I'm also joined by AARP Connecticut volunteer Maryann Trocchio. So I would love for both of you to take a minute to talk about yourselves and just tell people who you are. So Maryann, I think I'll start with you. Why don't you give us a little background on yourself?
Okay, thank you. Again, my name is Maryann Trocchio. I am born, raised, and educated in the great state of Connecticut. I have been with AARP for only 6 months, recently retired from many decades of being a registered nurse, still am, and teaching, but left bedside and administration back in May. I went to a 3-year school here in Connecticut because at that time that's what was present, and went on to get degrees and became a certified dementia provider. And my passion has always been hospice nursing, and also I was directors of a few assisted living. So giving my time and effort and passion to AARP for seniors is what I have chosen to do now. Thank you.
And we appreciate it. And bringing that excellent background to this kind of work is exactly what we hope for when we recruit new volunteers. Everybody has experience, and we've usually got a topic to match you up with. So Mairead Painter, why don't you tell us a little bit about yourself, your office, what you guys do?
Great. Thank you so much. And thanks for having me again. My name's Mairead Painter, and I am the State Long-Term Care Ombudsman, a word that many people are not often familiar with. My office works to promote residents' rights and individuals' voice. So that means that for people living in long-term care communities, nursing homes, residential care homes, and assisted living communities or managed residential communities, we work with them to ensure that their voices are heard and their rights are protected. If they have questions or concerns about their rights, if they want to know if something they're being told is correct, if they're worried about something that has happened to them and they want more information, but they're worried about it going any further than that, they can reach out to us because we're not mandated reporters and everything they talk to us about is confidential. Even if something is brought to us by a family member or a friend, we go to the source. We go to the resident, the individual who's impacted, and talk to them directly to see if they want us to move something forward. Just recently, we've started to serve individuals in the greater community. We have a very small sort of budget for that at this point. So we're working out what that's going to look like, but I'm excited to have us expand in that direction.
Yes, small is a good description of it, but small, and we're making progress. So, Mairead, one thing that I understand is that you have a leadership role with the National Association of Long-Term Care Ombudsman. So if people didn't know what it was necessarily here in Connecticut, they probably don't know what that means as a national organization. So I'm hoping you can tell us a little bit of that, especially since you're in that leadership position.
Sure, absolutely. So one of the things in my role, my team members advocate for individuals on an individual level in nursing homes and in those settings. My role as the state ombudsman is to advocate for systems change and legislative changes. And I do that both here in Connecticut, and then at the national level, I am the first vice president of the National Association for State Ombudsmen, so NASOP. And in that role, I work to advocate on behalf of long-term care residents and individuals receiving long-term services and supports at a national level to ensure that our laws nationally protect individuals and promote the rights of individuals in long-term care settings or receiving long-term services and supports, and also caregivers to ensure that caregivers have the supports that they need. We are one of the few states that really moved after COVID, moved forward with having caregivers be protected in long-term care settings. And we've been so thankful with the work that AARP has done in the greater community to protect caregivers.
Awesome. Thank you. Maryann, I think you have our question up next.
I do. So I know, Mairead, that you have worked very closely with AARP and you have this year as well as in the past. I wondered if you could tell us some of the policies and the changes that have occurred in the last few years, what you're particularly proud of in terms of positives for the state.
Absolutely. And the partnership with AARP, I think, makes us a little bit different than some other states, but I've seen how that partnership has really helped us be able to move legislation forward. And we're continuing that work this year, looking at how advocates can come together in order to promote positive legislation that really helps individuals. And so what we've done in the past, things that we've worked on is transparency, ensuring that our long-term care settings receive a lot of funding through Medicaid, right? And those federal dollars, taxpayer dollars, and we want to ensure that those dollars are being accounted for. And every year we kind of move that needle a little further and a little further. Last year we ensured that there aren't any funds that are being spent that we don't have an idea of how they're being spent. We asked for $0. We got it from 50,000 down to 30,000. This year we're still pushing for that to be zero. We're not quite there yet, but we're going to keep pushing. We've been working on access for individuals to really have control over their setting. So for individuals to be able to have the technology if they're choosing, that was huge during and right after COVID, for people to be able to have an Alexa or a camera in their room, things that were meaningful to them or helped them feel connected and protected. This year, some of the things that we continue to be working on are related to the definition of direct care. That's something we think is really important. How do you define what is direct care and who is providing that direct hands-on care to individuals in those settings, as well as the expansion of my office further to ensure that we're able to respond timely to the individuals that we serve.
Mairead, some of those, so that the audience understands, a lot of these things we were working on before COVID and didn't get any traction. So in the quote, my former state president, our volunteer state president here at AARP, the tarnished silver lining of the pandemic is that we have been able to make some progress in both community and in long-term care settings, in nursing home settings, where people now have more rights, more opportunity, there's more transparency. You've done great work on that. It has not been easy work. And I'm thinking of the, hundreds of hours a week you probably spent on phone and Zoom trying to get this stuff done in the first few months of the pandemic. So thank you for that. It doesn't go without remarking that a lot of our legislators have taken this a lot more seriously based on what they saw during the pandemic. So it's unfortunate that sometimes it takes something bad to happen, but we are learning and making progression from there. So with that, what about this legislative session? What's in the works? We're in a short legislative session, so that means theoretically no budget talk, that is definitely theoretically. There's always minor adjustments, but a short session means, we're working on policies that shouldn't have that much of a fiscal impact. But a lot of what you do does have a fiscal impact, and there's some asks for adjustments and ask for further change. Can you just elaborate on some of what you think are the top priorities for your office?
Sure. So for us, it is the expansion of our office to be able to have individuals to be able to respond to the calls. We have always committed to being able to get to people within 2 days, and we're currently not meeting that mark. I think since the pandemic and so many people knowing that our office is there and reaching out to us, it makes it really hard for us to be able to get to everyone timely. And that's really important, because when you're in a situation where you feel you have a question about abuse, neglect, exploitation, it's immediate, and they want that kind of immediate response, and we want to be there for them. So the addition of 4 people will be really meaningful, seeing as we only have 8 people now. So that's going to be doubling our team and our ability to get out there and respond to people. Also changing the ability and the scope. So giving me the ability to adjust how the team works and where they work and how they respond, so that we're flexible and fluid to the needs of the citizens in Connecticut. As I said before, really defining what is direct care and ensuring that legislators know that when the industry is talking about staffing and they want to include other disciplines or people who maybe are in leadership roles or out on transportation or doing other things, those aren't individuals that are providing direct care. Direct care to us means a CNA, a nurse, an LPN, someone who is directly working with the resident on the unit and providing them with support for their activities of daily living in order for them to have their best day. So I think those are the primary things that we want to see move forward this session, as well as changes related to transparency, further drilling down on who owns these buildings, how is the money being spent, where is the money being spent, and ensuring that the money that they're receiving from the state and federal government, taxpayer dollars, goes to those direct care workers and ancillary. So hands-on care, and then the other support services like food, laundry, housekeeping, but not directly to support owners or management companies.
Yeah, there's a lot of talk about, you know, investors in healthcare these days. And we're talking about in nursing homes, in hospitals, in walk-in clinics. So there's a lot of capital investment that goes in that doesn't necessarily drill down to good support for individuals who are in the care. So appreciate that. And if you toggle back a few episodes, we had Ernie Tosh, an attorney on who got really in depth on this issue. So if people want to look for the Ernie Tosh Coffee and Tea with AARP, you'll find that on our Facebook page in chronological order. Maryann, I think you're next.
You know, Mairead, that we've done a lot of work in support of the unpaid family caregivers for Connecticut, and there's at least 420,000. I think we've been involved together in meeting families in the past. So are there any agencies or actions that you can help tell families about in terms of what's current out there and what they could use for support when their member or loved one is in a nursing home or a skilled facility?
Absolutely. That's a great question because we're always trying to promote family councils. I think it's really important for individuals to know that they're not alone. It's a really hard decision to make to have someone move into a long-term care setting, or when the loved one themselves chooses to go into long-term care. It can mean a lot of changes for you, a lot of changes for them. Sometimes it's something they weren't expecting or something that they didn't necessarily want, but it's the situation they're currently in. And so to be able to support your friend, loved one, family member, and have that support for yourself, reach out and start a family council. The long-term care community is required to help have that established within the long-term care community, whether it be a nursing home or an assisted living managed residential community. They should be working with you to establish one. And sometimes that can feel a bit overwhelming is what we hear. And so we also are one of the first states in the country to have a statewide family council. If you go to our website, see the statewide family council page where you can get information, you can sign up to attend, and they'll help you start a family council in your individual building. They will help you come up with material for each month. And then some people say they don't really want to run a family council in the building. So I have purchased a Zoom account, and anyone is able to use that Zoom account. Any building can use that to run a family council, to have a meeting. Just let us know the date and time. We'll provide you with the link, and you can have people join that way so that you have privacy, autonomy, and you can do it after hours when you're not in the building, so that that time can be yours to spend with the person that you want to connect with in that setting.
Excellent. Thank you.
And AARP has a myriad of family caregiving resources, both nationally and statewide. And the importance of supporting people in the community when they're caring for a loved one is just immeasurable as a support to the very fragile healthcare system that we have and the very fragile long-term services and support system that we have. So it's really important to us. And if people want to request a presentation for their civic organization, their church group, something like that on family caregiving, we do have resources at AARP where we can send volunteers out to do that. And so, you know, we really want to help people help their loved ones. And you know, Mairead and you know, Maryann, we've worked on really important legislation over the past years and even this year to make sure that the state of Connecticut has a paid family and medical leave law so that caregivers don't have to choose between caring for a loved one and their job. And we also this year are working on expanding the definition of who you can care for under the paid sick leave laws in Connecticut. So we're trying to align the definitions with paid sick leave and the paid family and medical leave, which are two different laws and sound similar, but they're not. But to align the definitions so that more people can care for their loved ones, whether it's their domestic partner or their in-law, or their step, the list goes on, to make sure that we as a community can keep people out of long-term care facilities, keep people safe, keep people healthy, and keep people earning a living, because we can't have to make those decisions, right, between caring for someone and paying your mortgage. It just doesn't work. So Mairead, I'm going to ask you one last surprise question. And just, do you want to talk a little bit about the Elder Justice Coalition in Connecticut and the work you do as the co-chair of that group? I'm never sure whether to call it an organization, a group, whatever it is, but we have a website for it. It is an official group, and we do have resources for people.
We do. So our Elder Justice Coalition, which AARP is I believe one of the founding members of and support members of, works with us. I feel like all of my groups and all of my advocacy work, AARP is right beside us, which is always reassuring. And with our Elder Justice Coalition is really a public-private partnership that comes together to ensure that people are protected, right? Looking at abuse, neglect, and exploitation from not only where the state sits and how the state can protect people, but also organizations within the community. And how do we come together to identify challenges, to support communities, and to get information out to people so that they know where to go, so that they're well informed and they support each other. What we really hear is that older adults talk to each other, right? They're more likely to ask a friend, a peer, someone they know, talk to them when something's going on. And if that person doesn't have the information or know where to reach out, it can be a problem. So we want to make sure everyone's really well informed. And if you want, we can always come out and we can speak to any civic groups. If you have a group, a women's group, a men's group, VFW, anything like that, we're happy to come out and talk about what the Ombudsman's office does, elder justice, how to keep yourself safe in the setting of your choosing. We want people to live where they want to live, feel good about it, feel safe, and to have the resources in those communities to live a happy and productive life.
Yes, and I appreciate working with you and all the members of the Elder Justice Coalition and just collaborative work to make sure that we don't have some of the problems that we've seen in the past. It's a struggle to do these things, but it's worth it. And I really want to thank you for what you've been doing this past legislative sessions and beyond. I want to thank everyone who's tuned in for another episode of Coffee and Tea with AARP Connecticut. Join us again in 2 weeks for another episode, and catch back episodes right here on our Facebook page, or if you prefer YouTube, you can head over there and see so many videos that we have from AARP Connecticut, these and others. So, and then I'd ask, if you are interested in helping us advocate to advance policies the way Maryann does and the way so many of our volunteers do, please scan the QR code below and become an e-advocate. This will help you, at a touch of a button, help us advance policies that are important to the 50 plus in Connecticut. And you can always contact us at ct@aarp.org if you want to become an AARP Connecticut volunteer. So I appreciate everyone's time, your interest, and your continued viewing of our amazing little series that we have here on our Facebook page and our YouTube channel. So to you too, thank you for all you do, and happy spring.